first community conversation, we're joined by Danielle Schrader, an oncology certified nurse with Sentara Martha Jefferson Hospital. She's sitting down with Aaron.
Thank you, Danielle, for coming in today. It's good to see you again.
Good to see you too. Thank you for having me.
You are very welcome. So you're here during National Cancer Survivors Month. So can you just start by sharing what exactly is survivorship? What does that mean, and why is it important to recognize this journey?
So survivorship is it's a lifelong process. It starts at diagnosis and it actually extends beyond cancer treatment. And it's so important to recognize folks as they go into active surveillance after they finish their treatment, to make sure that they know and understand they still have the continued guidance and support from their healthcare team as they're going through that cancer journey.
That's beautiful. And you know, life after cancer can bring a mix of emotions and new challenges as well. What are some of the common concerns that survivors face, and how does your team help them navigate their new normal?
Yes. So everyone's new normal may be a little bit different. They've been on an emotional roller coaster. I think the biggest fear that folks have is recurrence, the cancer coming back. I think a lot of people are still dealing with some of the side effects from treatment that they may have had, and some of those late side effects that come on after treatment. So I think it's really important for us to continue to provide that support and guidance to the patients. We have navigators that will help patients as they go into cancer survivorship and active surveillance, but just being truthful and being honest with yourself and with your healthcare team, just to make sure your needs are still being met.
And then what kinds of services or resources does Sentara Martha Jefferson offer to patients after treatment ends?
So we do have our navigators and oncology social worker that is still available to those patients. Patients will have routine follow-ups with their oncologist. We also provide a cancer rehab program. We also have exercise programs called Moving On, where patients can get back out there, and also some peer support from other individuals who have gone through a cancer journey as well.
Yeah, that's probably beneficial for survivors to kind of commune and share their journeys together.
Absolutely.
That's wonderful. And then why is it so important for cancer survivors to stay connected with their care team even after treatment is complete?
Because their cancer journey doesn't end there. We always want to make sure that patients have an individualized care plan as they go into active surveillance, making sure that they are getting the appropriate lab work, appropriate imaging done at those intervals that are necessary, just to keep an eye on to make sure that that cancer has not returned.
That's great. And then how can survivors connect with you all? How can they access your resources?
So really just reaching out to their healthcare provider. They should still be working with one of the oncologists. Someone in their team will be able to get them connected, whether it's with one of our oncology navigators who can reach out to our cancer rehab program, our exercise programs, and we'll make sure that they get to those resources.
That's wonderful. Thank you so much, Danielle, for coming in. It was great seeing you again.
Good to see you too. Thank you
so much.